Hey everyone, and welcome. Today, we're diving deep into a topic that affects millions worldwide: what happens when you have your gallbladder removed? This common surgical procedure, known as a cholecystectomy, has significant implications for your digestive system and overall well being. Understanding these changes is crucial, whether you're a health enthusiast, a post surgery patient, or a medical student. Our goal is to provide you with comprehensive, clear, and actionable information. Let's explore the journey of living without a gallbladder. First, let's establish what the gallbladder is and its vital role. It's a small, pear-shaped organ nestled just beneath your liver. Its primary function is not to produce bile, but rather to store and concentrate it. Bile itself is a crucial digestive fluid. It's produced by your liver and plays a key role in breaking down fats from the food you eat. When you consume a meal, especially one high in fat, the gallbladder contracts, releasing concentrated bile into your small intestine to aid digestion. So, why is this small organ often removed? The most common reason is the formation of gallstones. These hard deposits can vary in size, from a grain of sand to a golf ball. They form when substances in bile, like cholesterol or bilirubin, harden. Gallstones can cause a range of significant problems. They might block the bile ducts, leading to severe pain and complications. This blockage prevents bile from flowing freely, disrupting digestion and potentially causing inflammation. Symptoms that often necessitate gallbladder removal are distinct and can be quite debilitating. Severe abdominal pain is a hallmark, typically located in the upper right abdomen. This pain can often radiate to your back or right shoulder blade. Nausea and vomiting are also common, particularly after consuming fatty foods. Your body struggles to process these fats without the concentrated bile release from the gallbladder. This can lead to significant digestive distress. In more severe cases, jaundice may occur, characterized by a yellowing of the skin and eyes. This happens when bile flow is severely obstructed, causing bilirubin to build up in the bloodstream. It's a serious sign requiring immediate medical attention. Cholecystitis, which is inflammation of the gallbladder, is another frequent reason for removal. This inflammation is often caused by gallstones blocking the cystic duct, leading to pain, fever, and tenderness. If left untreated, it can lead to infection. The potential for infection within the gallbladder is a serious concern. Blockages and inflammation create an environment ripe for bacterial growth. An infected gallbladder can lead to a life-threatening condition if not addressed promptly. The surgical procedure to remove the gallbladder is called a cholecystectomy. It is one of the most common abdominal surgeries performed globally. This procedure is recommended for individuals experiencing problematic gallstones, recurrent infections, or other significant gallbladder issues that compromise their health and quality of life. The good news is that it is entirely possible to live a perfectly normal and healthy life without a gallbladder. Your body is remarkably adaptable, and your digestive system will adjust over time. Many people experience significant relief from their previous symptoms after the surgery. Your liver continues to produce bile, just as it did before. The key difference is that there is no longer a storage sac to hold and concentrate it. Instead, bile now flows directly from the liver into your small intestine. This continuous, unregulated flow is what leads to most of the post-surgical adjustments. You may notice some changes in your bowel habits, particularly in the initial weeks or months following the surgery. This is a common and expected adjustment as your digestive system adapts to the new bile flow. These changes are usually temporary. Many individuals report more frequent or looser stools. This occurs because bile, which previously would have been released in a controlled burst, now continuously enters the small intestine. This can have a laxative effect. This change in bowel habits is particularly noticeable after eating fatty foods. Without the gallbladder to provide a concentrated dose of bile, your body may struggle to emulsify and absorb fats as efficiently. Undigested fats can then pass into the large intestine, drawing water and leading to diarrhea. Your body may indeed be less tolerant of high-fat meals. Large quantities of fat can overwhelm the digestive system, leading to discomfort, bloating, and the aforementioned loose stools. It's a direct consequence of the altered bile delivery system. Therefore, a key recommendation for life after gallbladder removal is to consume smaller, more frequent meals. This approach helps your digestive system manage the continuous, less concentrated flow of bile more effectively. It prevents overloading your system with large amounts of food at once. Another crucial dietary adjustment is to avoid excessive fats. While you don't need to eliminate fats entirely, moderating your intake, especially of unhealthy saturated and trans fats, can significantly reduce digestive upset. Focus on healthy fats in moderation. In some cases, individuals may experience what is known as bile acid diarrhea. This condition occurs when excess bile acids reach the colon, irritating its lining and causing persistent diarrhea. It can be a challenging symptom for some patients. Fortunately, bile acid diarrhea is usually temporary. Your body often finds a way to adapt and regulate bile acid absorption over time. However, if it persists and significantly impacts your quality of life, medical intervention may be necessary. Your doctor might prescribe medication to help manage bile acid diarrhea. These medications, known as bile acid sequestrants, bind to bile acids in the intestine, preventing them from irritating the colon. They can provide significant relief for those affected. The good news is that most people adapt remarkably well to life without a gallbladder. The initial adjustments typically subside, and the digestive system finds a new equilibrium. Many individuals report feeling much better than they did before the surgery. The vast majority of patients experience no long-term health problems directly attributable to gallbladder removal. While dietary modifications may be necessary for some, the absence of the gallbladder does not inherently lead to chronic diseases or complications. It's a testament to the body's incredible ability to compensate. Let's delve into some unique insights and practical tips for managing life after a cholecystectomy. One term you might hear is the bile dump. This refers to the sudden, unregulated release of bile into the small intestine, especially after a meal. This bile dump can indeed cause digestive upset for some individuals. Symptoms might include abdominal cramping, bloating, and an urgent need to use the restroom. It's a direct result of the liver continuously producing bile without a storage reservoir to regulate its release. Incorporating probiotics into your daily routine can be highly beneficial. Probiotics are live microorganisms that, when administered in adequate amounts, confer a health benefit on the host. They can help improve overall gut health and balance the microbiome. A healthy gut microbiome can significantly reduce digestive issues experienced after gallbladder removal. Probiotics can aid in the digestion of food and may help mitigate the effects of altered bile flow. Consult your doctor before starting any new supplements. Furthermore, a diet rich in fiber can be incredibly helpful in regulating bowel movements. Soluble fiber, found in foods like oats, beans, and apples, can absorb excess water and help solidify stools. Insoluble fiber, found in whole grains and vegetables, adds bulk and promotes regularity. Fiber helps to normalize stool consistency, whether you're experiencing loose stools or constipation. It acts as a natural bulking agent, which can be particularly beneficial when dealing with the altered digestive rhythm post-cholecystectomy. Gradually increase your fiber intake to avoid gas and bloating. Perhaps the most important piece of advice is to listen to your body. Everyone's digestive system is unique, and your individual response to gallbladder removal will vary. Pay close attention to how different foods affect you. Keep a food diary to track what you eat and any symptoms you experience. This can help you identify trigger foods that cause discomfort. Over time, you'll learn which foods you can tolerate well and which ones to limit or avoid. Adjust your diet accordingly based on your body's signals. This personalized approach is far more effective than a one-size-fits-all dietary plan. Be patient with yourself as your body adapts and you discover your new normal. In summary, gallbladder removal is a significant surgical procedure, but it's one that most people recover from very well. While there are potential adjustments to your digestive system, particularly concerning fat digestion and bowel habits, living a perfectly healthy and normal life without a gallbladder is absolutely possible. The key lies in understanding these potential changes and making informed dietary and lifestyle modifications. Your liver continues its vital work, and your body is remarkably adept at compensating for the absence of this small organ. With a little awareness and adaptation, you can thrive. We strongly encourage you to consult with your doctor or a registered dietitian for personalized advice. They can provide guidance tailored to your specific health needs and help you navigate any challenges you might encounter. Professional medical advice is invaluable for your post-surgical journey. If you found this information helpful, please give this video a thumbs up. Subscribe to our channel for more in-depth medical explanations and health insights. And don't hesitate to leave your questions or share your experiences in the comments section below. Thanks for watching, and here's to your continued health and well-being.